province. As of 24 o'clock, April the 30th, the accumulative confirmed cases of COVID-19 in the province reached 68,128, among which 50,333 in Wuhan, 17,795 in other cities and prefectures. On April the 30th, from 0 to 24 o'clock, the number of newly added COVID-19 cases in Hubei was 0. There was no imported case. For the province, in 27 days in a row, we reported 0 new confirmed cases. In other regions out of Wuhan in the province, for 57 days in a row, reported 0 new confirmed cases. As of 24 o'clock, April the 30th, we have 0 existing confirmed cases and 0 existing suspected cases. The accumulative fatal cases in the province numbered 4,512, and the accumulative discharged cases reached 63,616. From 0 to 24 o'clock on April the 30th, we have 19 newly added asymptomatic cases, none of them developed into confirmed cases. We moved 11 cases from the quarantine, and still 631 asymptomatic cases are under medical observation. Now I'd like to give the floor to Mr. Yang Yunyan to talk about the work of Hubei in the epidemic control for regular basis. Friends of the press, good afternoon. Now I'd like to talk about the new changes with the risk level and also the epidemic control on a regular basis. Under the strong leadership of the CPC Central Committee with Comrade Xi Jinping at its core and with the coordination of efforts of all the authorities, the battle against the COVID-19 in Hubei has achieved its great success and victory. Currently, we have moved from an extraordinary epidemic control to one that is on a regular basis. According to the working plan of the province, based on the current development of COVID-19 in the province, the headquarters of Epidemic Prevention and Control of the province of Hubei has decided that since 0 o'clock on the 1st of May to lower the alarming level from level 1 to level 2. First of all, the degradation of the warning is based on several considerations. First of all, we have organized the experts to make an evaluation of the situation of epidemic as well as the capacity of control for the coming future. We have several conclusions. First of all, we have basically curbed the spread of the epidemic. After outbreak of COVID-19, we have applied the lockdown measures, and we have also cured the patients on a very fast track. Those are the double measures. At the same time, we also have the fast detection lockdown measures on the communities in total series of policies that have helped us to successfully curb the spread of the COVID-19. Until now, for 27 days in a row, we have reported 0 new confirmed cases, and all the places in the province have dropped to the level of low risk. We have also cleared all the patients in the critical and severe conditions, and also later we have cleared all the patients in the hospital. We have successfully curbed the spread of COVID-19 in the mass. Since the 31st of March, for 32 days in a row, we have no imported case. And also for a long period of time, there's no imported asymptomatic cases. Currently, we have a system of direction and also a system of detection and monitoring in place. We have enough hospital beds and sufficient curing capacity. We also have sufficient laboratory capacities for detection and also the supplies of medical care. It can help us to prevent the possible risk of a rebound domestically. And third, we have basically formed a mechanism of permanent work of epidemic control on a regular basis. We have clarified the responsibility of all the authorities, and we have also raised the self-awareness. After careful studies and evaluation, we have been qualified for this degradation of warning from level 1 to level 2. Second, after the degradation of the warning, we still keep the focus of our work on several areas. After degradation, we will continue to prevent the domestic rebound and imported case. We will adopt detailed measures to strengthen the epidemic control on a regular basis. In major workplaces and for key groups, we will keep an eye on them. More details are like, we will stick to the CPC leadership, and the representatives of the CPC Commission will take the biggest responsibility. And second is to continue our work on the community basis. We will make targeted efforts in the community management. We encourage the residents to stay at home as much as possible, and also encourage them to take care of their personal hygiene and also to avoid excessive gathering of the people. They will also closely follow the status of health of themselves. If they have chest tightness or coughs, like symptoms like that, they have to go to the doctors. And third, we have to have a permanent mechanism for the management of work resumption and education resumption. For four parties, like the employees, employers, individuals, etc., everyone should play its role. On the basis of applying the epidemic control measures, we have to resume the schools in different dates. And fourth is to strengthen the management of key groups. We have to carry out on a continuous basis this epidemiological survey on the key groups of people. For the asymptomatic patients, we have to continue with the screening and increase our capacity of the detection and monitoring. For the major groups of people coming from elsewhere to visit the province and people to leave the province, we have to give strict examination of their health conditions. For people visiting the province, we have to follow the 4 musts. Number 5, for the public places, we have to strengthen the management. For the enclosed places, with an aim or a function for recreation, they will continue to be shut down for the next period to come. For those workplaces that are closely related to people's livelihood, they are allowed to open, and for the people accessing those places, they are required to put on their masks and also take care of their personal hygiene. For those utilities under frequent use, they will be disinfected on a regular basis, and also the ventilation will be respected. For the tourists, they will also get their temperature checked. For those people refusing being checked with the temperatures and refusing putting on a mask, they will be refused access to the tourist sites. If we find a fever patient, we will directly take relevant measures to treat with that. And sixth, for the hotels, restaurants, according to the existing requirements of epidemic control, we will apply a permanent mechanism of the control of the flow of people, the volume of the clients. And for the open-air restaurants, we will respect the social distancing of the dining tables. And for people accessing those places, like the restaurants, they will get their temperatures checked. And on a daily basis, the whole place will be disinfected regularly. And for people accessing to hotels, they will also have to check the temperatures and show their health code. And it's forbidden to open for the moment the enclosed gyms and other recreation places. And seventh is to prevent the epidemic development within the hospitals. We encourage people to have medical consultations online. If they indeed need to go to the hospital, they have to make an appointment in advance. And for the fever outpatient part, we have to create a closed loop in order to prevent the cross-infection. Number 8, we will strengthen the publicity and campaign of necessary knowledge to the public so that their self-awareness can be further raised. They will respect the rule of avoiding the gathering, washing their hands often, and also wearing a mask. In a word, the degradation of warning from level 1 to level 2 doesn't mean that we are lowering our bar. Instead, it's another challenge to our self-restraint and also our patience of this work of epidemic control on a regular basis. We have to be alert as usual against the epidemic, and according to an evolving situation, we have to take adapted measures so that we will not let those efforts and sacrifices we made in the past wasted. So finally, we can have the victory both on the front line of epidemic control and work resumption. Since we will lower this warning from level 1 to level 2 since the 0 o'clock on the 2nd of May, so still for today, we will still take actions according to the requirement of level 1. Now the floor is open for your questions. Please first identify yourselves.
我是人民日报记者。请
I'm
问
from
通
People's
过前期的
Daily.
疫情防控，我省新冠
I'd
肺炎
like to
疫情
know
应对
that
的能力有哪
after
些
the
方面的
preliminary
变化？谢谢。
efforts of epidemic control, what are the development of your capability of fighting against the epidemic? Thank you for your question. Since the 0 o'clock of the 8th of April, we have lifted the restrictions in the transportation. And later, we have joined the low-risk areas. On the 2nd of May, that means tomorrow, we will lower the warning from level 1 to level 2. It means the battle of protection of Hubei and Wuhan has already obtained its biggest victory. Currently, considering the epidemic still developing in the world, we will continue to stay vigilant against the domestic rebounds and introduce the cases. Facing the risk of a rebound domestically, we will continue to stay vigilant, always get ourselves prepared, and to have an acceleration is better to have an ignoration of the risks. First of all, we have improved the curing and treatment capacities. At different levels of government, we have already prepared the hospitals, for example, the backup hospitals and also designated hospitals for the treatment of patients. We also have prepared the quarantine areas. For the hospitals above level 2, we have added the outpatient department for patients of fever. We have also the fever patient clinic. For all the fever patients, they can get a neighborhood treatment at first, and according to the risk, we can immediately activate the quarantine area and also the hospital beds. Second is the better management capacity on the basis of the society, for the community, for supermarkets, schools, tourist sites, those major areas and workplaces. We have set up the active monitoring mechanism for the fever patients so that on the social basis we can have an early discovery and early report of the fever patients. This will be reported on the regular basis of every 2 hours, and every 24 o'clock we will have the epidemiological survey. Once we have discovered a gathering of people on the basis of community or a risk of a spread of COVID-19 in the communities, we will immediately take actions. With every new discovery of the patient, we will take immediate actions in response. And third, currently, all the hospitals have resumed the normal order of the services, and also for the producers of the medical supplies, they have resumed their restoration of capacity in order to provide with sufficient medical supplies to the hospitals. And fourth is that people have raised their self-awareness. They pay more attention to their health status and personal hygiene, and they can better respect the rules of visiting the hospitals. Today, they have developed the habit of washing hands often and always putting on a mask. We have also used online programs to set a campaign on the knowledge necessary for the COVID-19 prevention and control. This has significantly improved the overall capacity and the awareness of the people. We are still in the process of fighting COVID-19. We should not lower the bar and continue to make the efforts in the epidemic control on a regular basis. And we will also seize the opportunity of the publication of preferential policies by the central government to boost the socio-economic development and at the same time to improve our capacity in the emergency response. Next question,
您好，
please.
新华社记者提问。
I'm from China News Agency.
我们知道明天的话，全省的疫情防控已经响应，由1级降
We know that from 0 o'clock tomorrow we will lower the warning from level 1 to level 2. So why are you sticking to this epidemic control on a regular basis? I'll give the floor to Mr. Li Tao. Thank you for your question. We have made this success in the battle against the COVID-19 in Wuhan. It comes after our long-term efforts, and currently some people, they have lowered their self-awareness and vigilance, and there are also the risk of the rebound, and there are also the asymptomatic cases. In order to fight against the risk of the domestic rebound and facing this complicated task, we have to ask ourselves to stay vigilant. To this end, our city has, on purpose, continued with our efforts in the epidemic control on a regular basis and stick to the closed management of the communities. First of all, we have mobilized more people, including the residents and workers in the community, and also combined with the participation of the volunteers to join in the management of the community. We also selected the leading person of every building of the community and also organized the patrolling teams. Second, we have improved the control measures. For the exit and entry points, we have strengthened the controlling power. Currently, according to the evolution of the situations, we will ask people to show their ID card and also their pass as well as their health code. We have also applied technology-based tools to facilitate our work. Third is to strengthen our publicity. We have created the WeChat chatting group-based information sharing groups as well as other internet-based tools so that we can give the access to information as soon as possible to the people. We also have the patrolling team inside the community so that there will not be the excessive gathering of the people. We also encourage people to joining the development of a zero epidemic community. Fourth is the fundamental work is on the progress for the people cured but returning to the status of a positive nucleic acid test and also the asymptomatic cases as well as other people returning from a high-risk work position. They have to be put under the quarantine and under the monitoring. For the corridors, stairways, and other social places and infrastructure, we have to maintain the daily basis of ventilation and disinfection and also encourage people to build up good habits like washing hands often and putting on a mask. For old people living alone, people with disabilities, and children living in difficult conditions. We will visit them every day or call them so that we can help them when they have this need. Number 5 is to ask people to shoulder their responsibilities. We have to stay vigilant against domestic rebounds and imported cases. We should not lower the bar, not lower our standards of management, and put on this mechanism of permanent control on the community. In cities and counties and villages, the 3 levels, we have the mechanisms in place, and today we have the mass-based control and also community-based control. We encourage the people to join in this overall control of the epidemic, and for those people causing a problem for our management, we will punish them. Today we have been transferring our warning and epidemic control towards a regular basis. What are the requirements for the regular basis of epidemic control? Thank you for your question. While concluding from our best practices of the past, we have to make a response to the evolving situation of the degradation of warning from level 1 to level 2. We have to clarify the focus of our work. We have to, for example, make a systematic effort and also join the efforts involving the people's participation in the epidemic control, so that we can at the same time improving the capacity of treatment of patients and epidemic control in the society. Major measures as follows. First of all, we have to prevent the domestic rebound and imported cases. We should have an early discovery mechanism and targeted management, as well as a tailored plans and solutions for the treatment. After having a mechanism of the early discovery, we can do the early treatment and early monitoring. For all those loopholes that may lead to the domestic rebound, we have to take care of them. First of all is to strengthen the monitoring and evaluation for hospitals, CDC, schools, enterprises, supermarkets, transportation stations, as well as other major public places. We have to carry out an active monitoring and also a monitoring on the key groups of people, so that we can have a monitoring and early warning system on the public health system. And by doing that, we can improve our capacity and vigilance for the public health status. Today, we have the early warning system for the public health risk. This will help us to make better targeted solutions on the epidemic control. Second, to set up the treatment mechanism of epidemic on a regular basis. Prevention and control should be combined continuously. On different levels, we will maintain the working groups of epidemiological service and transfer of patients. For the public institutions, they have to work together with the medical institutions for the consolidation of the transfer, diagnosis, and the treatment in order to form a closed loop. And next is to set up the front line on the basis of community. We have to encourage those residents of the community to join our efforts in controlling and preventing the epidemic. Once there is a discovery of the symptoms, we have to make immediate reactions. For all parties participating in the community epidemic control, we have to clarify the responsibility of each of them and also make sure that they can always communicate with the government. And third is to strengthen people's recognition of the importance of this work. For the people visiting the province, we have to follow their traces and also keep an eye on it, check their temperature and their ID card. For people visiting the province, they will be put into the quarantine, or they can have a community at home quarantine. Fourth, for the management of asymptomatic cases, we have already elaborated a provincial-based working plan. For all those key groups, we have to check everyone's nucleic acid test, and for the other people, it's on a voluntary basis. For the results and information collected, we have to upload it into the online platform so that we can have a closed loop of the data. And next, we have to strengthen our management of major places and of the key groups. For key areas like the schools, supermarkets, transportation areas, and tourist sites, we have to ask those owners and persons in charge to shoulder their responsibility so that we can better protect those people in the key groups. We also have to strengthen our publicity to share with people the development of the relevant rules and regulations, the laws, and our working plans. In general, we have to give people more knowledge, to give them access to the information, so that people will be more willing to join our epidemic control efforts. Next question, please. I'm from China Daily. In order to continue with epidemic control on a regular basis and also give the access to medical care to the people, we have encouraged the hospital doctors to go into the communities to give services to the people. Are there any other measures to help the people? On the 29th of April, we have initiated this movement of tens of thousands of doctors to serve the people living in the community. We have selected doctors and nurses to go to the grassroots hospitals so that they can serve the mass. Those doctors from upper level of hospitals are giving the training opportunities and also accompanying the daily work of the grassroots doctors. The big hospitals and grassroots hospitals are in the liaison status for collaboration so that they can better join their efforts in the epidemic control inside the hospitals. We also have the tier treatment system in place. At the same time, we also have a science-based targeted solution for the detection and distinction of the patient. The grassroots is the front line of the detection of the patients. First of all, for the epidemiological survey, it's a very important measure. For the key groups of people, we have to give access to the nucleic acid test to everyone, and for the other people out of the key groups, they can have the test on a regular and voluntary basis. And third is to give more knowledge to the people. For example, give them publications, the booklets. And fourth is to have the tier treatment mechanism. For the general outpatient and fevered patient outpatient, we have to have a separation measures. And on a regular basis, we have to report the detection of the fever outpatients. And number 5, we organize the experts to run a test and also to have a treatment of the outpatients with fever and also asymptomatic cases. Last question for the day. I'm from Hubei Voice Radio. Due to the epidemic control, many people have stayed at home for a long period of time, and now during the vacation they'd like to have a visit outside. So what are your suggestions to them? To Mr. Li Yang. Thank you for your question. When you are going outside for the sightseeing, you have to pay attention to the following tips. First of all, you have to have 2 apps. First of all is the app from the State Council, which will allow you to trace your trajectory in the past several days. And second is the app that can show a green health code. You have to do the application before going outside. Number 2, you have to have a better understanding of the 2 policies. First of all, the destination government policy, and get yourself prepared before arriving to the destination. And secondly, you have to have a better knowledge about the prevention and control measures of the sightseeing areas and the tourist spots. And it's better to make an appointment for the purchasing of the ticket and avoid gathering of the people. The third tip, you have to have enough stock of 2 things. First of all, the masks, and wear the mask in the correct way. Second is the stock of the alcohol-based disinfectant of your hands or the alcohol wipes. Number 4, to make 2 prejudgments. First of all, the prejudgment about the status of your hotel and also the destination. If there's any risk, please cancel as soon as possible. And the second prejudgment is about the road conditions. If you predict a traffic jam on the road, please try to find another solution and avoid that part. Number 5, if you want to cough or you want to sneeze, please cover your nose and your mouth and do not spit anywhere. 6th is to respect the good habits in dining in the restaurants. Try to shorten the period of staying in the restaurant and avoid to participate in 2 types of activities. The first is activity with an excessive gathering of people. You should not go to the crowded places and always respect at least 1 meter of the social distancing. And the second is to avoid the gathering of the eating and dining. Number 7, keep 2 types of information. First is your information of your trajectory, like all the receipts, proofs, and also the reservation information on your phone. And second is the medical consultation information. In the destination places, you have to, in advance, check online their medical institution information. Number 8, 2 types of people should avoid going out. Pregnant women, elderly person, and people with severe diseases. They should not visit elsewhere. And another type of people avoiding the visiting other places, they are people with a non-grain cold and with fever or asymptomatic cases condition. So thank you for all the questions. Since tomorrow we will downgrade the warning from level 1 to level 2, and for the press conference frequency, we will also make a change. Next press conference will be organized on the 4th of May.